Hello, I am Marwan Aburas. In this presentation, we turn our attention to the clinically oriented radiographic analysis of the pulp chamber. Very often, the pulp chamber is overlooked. Our eyes are trained to be drawn to more dramatic findings on the periapical radiograph: deep fillings, metal posts, pins, large cavities, periapical radiolucencies, bone loss. But in doing so, we may ignore the accurate and most important biological compass, the pulp chamber. The pulp chamber is a unique diagnostic landmark. It is where I begin my diagnosis, especially when evaluating intact teeth and those with intracoronal restorations. It serves not just as a radiographic structure, but as a biological and procedural guide in every stage of the endodontic decision-making. This presentation had three objectives. The first, we outlined the pulp chamber role in endodontic treatment across all the phases: before treatment, during treatment, and after treatment. And before, it helps in vitality determination. Whether the image is lucent means vitality and health and soft tissue, or opaque means calcification, or inability to respond because of this pulp stone, denticles, diffuse calcification. During the treatment, it serves as a guide for proper access preparation, ensuring that you have the straight line access to the apical third. After treatment, the pulp chamber becomes a reference point for the post and build-up, for the post and core. We must have it sealed to prevent coronal microleakage. So you can see biological guidance. The second objective, I would like to revisit the radiographic characteristics of the pulp chamber in various biological states. You will learn how to distinguish a healthy pulp chamber from one that is stressed, atrophied, collapsed, calcified, and these observations should be integrated in your decision-making. Whether you are doing a crown preparation, vital pulp therapy, endodontic treatment. The third objective, I would like to introduce the clinical concept, very important, in the pulp chamber again. It's called pulp chamber constriction. This is a biological and radiographic phenomenon. It presents as reduction in the pulp chamber size, collapse, shrinkage, with radiolucency being replaced with radioopacity. What's happening here? The soft vascular tissue, neural tissue of the pulp is being gradually replaced with pulp stones, denticles, diffuse calcification, evenly throughout its size. And then we slowly see it as a fainting image. The pulp chamber is not a radiographic landmark. It's a biological entity, okay? It tells you a lot about the tooth age, immune response, what it has gone through. To conclude, The pulp chamber is not just, as I say, the radiographic image. It's a biological and diagnostic hub of the whole endodontium. It protects the pulp. It governs its healing and sets the course of treatment. In my practice, I always begin with the pulp chamber first, because that's where the whole story begins. Let's now explore the details of this critical diagnostic area. Thank you.